The Lagos State Ministry of Health has reported 29 deaths and 579 cases since the cholera outbreak began 2 weeks ago. Speaking on Monday during a press briefing, the Lagos State Commissioner for Health, Professor Akin Abayomi, explained that the death rate was due to patients being presented late at a hospital or brought in dead. He adds that no case had been reported in schools. On June 11, 2024, Abayomi warned that the state had recorded an excess report of severe gastroenteritis cases. Abayomi disclosed that cases have been reported in communities around Etiosa, Lagos Island, Ikorodu, and Kosofe local government area of the state. And joining us to discuss more on this is Doctor Adefolarin Opawoye. He is an infectious disease consultant at Lagos University Teaching Hospital and public relations officer, Nigeria Infectious Disease Society. Good evening. Glad to have you join me.
Good evening.
Let me just start by...
Glad to be here. Thank you very much.
The pleasure is all mine. I'll start by asking you, are there any factors that make this case more severe in Lagos compared to other states of the country?
Well, apart from the fact that we're a mega city and everything we tend to magnify it, whether it is good or bad in terms of money, the amount of money circulating in Lagos is probably more than other places. So the reality also is that when it comes to things happening like diseases like this, which are worse in densely populated areas, then you can expect that there will be a higher number of cases in Lagos. Also, remember that Lagos has a very robust surveillance system, so it's easier for us to pick up cases than some other people will. So a combination of factors of densely populated areas, the sanitation conditions, and also the enhanced surveillance will mean that we'll record more cases than most people will. Thank you.
It's interesting you touched on Lagos being a mega city and also being highly populated. How effective are treatment protocols in managing these epidemic we have at hand as cholera cases, considering the challenges mentioned by the Commissioner for Health about late presentation?
Yeah, the treatment protocols are effective. However, it's difficult. Our health-seeking behavior generally is not the best. People tend to present to the hospital quite late, for various reasons. I've seen patients who came in late because there was no one to take care of the children at home. A lot of people actually did not realize the seriousness of the condition. Some collapsed right there on the toilet where they were still pooing. So those are the challenges. Cholera is not that difficult to treat in terms of the severity of illnesses. We have illnesses which are much more difficult to treat if people come in early. But when people don't come in early, then it becomes a bit more complicated. Some will eventually end up with renal failure, and even after the initial symptoms have gone. So coming to the hospital early is very important. And we have seen now that treatment is free in the state hospitals. So hopefully this will encourage people to come earlier, and also the importance of starting to take ORS. That's the oral rehydration salt. Immediately you have symptoms. People underestimate the effect of the diarrhea, and that is what is leading to some of the mortalities that we have been seeing so far.
You talked about people not presenting themselves early enough in hospitals. What role then does public awareness or even education play in preventing and also responding to outbreaks of cholera, and other related illnesses?
Yeah, public awareness is hopefully what we are trying to do here, and you also play your part by making a segment on this. Also, it's important to note that a lot of teams have gone out to the various local governments at that level, to the markets, to the churches, also to sensitize them and educate them, number one, on prevention, how to protect themselves better, and also that if in case they have symptoms, how to start treatment even before, and to present earlier at the hospital. So there's a huge role that education and awareness plays in curbing this kind of issues. Number one, to prevent them from happening in the first place, and also to minimize the impact once it's begun. And hopefully we are all trying to play our part in this public awareness and education.
Now, looking at an urban, state like Lagos State, you mentioned earlier on that Lagos is a mega city, highly populated. What are the challenges in preventing and controlling an epidemic like cholera in Lagos State?
Yeah, so the numbers are a big deal. And when it comes to cholera, cholera is mainly an environmental a disease of environmental proportions. Is the environment that's actually the problem, then manifests as a health problem, issue. There's something we call WASH, which is what we try to do. That's looking at the water, sanitation, and hygiene. And when you have challenges with the WASH, which is provision of potable drinking water to people, where there are problems with sanitation, a lot of people are still defecating in the open, and that is why some of these things coincide with rainy season. When rain falls, water table goes up. Some of improperly disposed waste will flow into surface water, which people will drink, and then you have this terrible cycle of different waterborne diseases. So dealing with this things can be challenging in a city as densely populated as Lagos, that the government is trying. However, we know we don't have very good drainage. We don't have very good water supply to most homes. Most homes don't have pipe or water. And also, we also have to take responsibility for ourselves. And, when you have more numbers, then it's very difficult to police people and get them to do what is right. So those are the challenges with water, challenges with sanitation, challenges with hygiene that a mega city like Lagos will face in handling an outbreak of this size.
Thank you so much for your insight on the news, Dr. Adefolarin Opawoye. Many thanks once again.
Thank you very much.